There are 5 major risks that I inform patients of before they are willing to have a breast augmentation. First risk is infection. We give them prophylactic antibiotics after the surgery. Infection is extremely rare. In my own experience, it happens once in every 500 to 1,000 patients. If there were to be an infection, you usually have to remove the implants, wait a suitable period, and put them back in again. Of course, there would be no charge for the procedure if that was necessary. But again, very rare. Also pretty rare is bleeding after the operation. It's never life-threatening. What can happen is a little blood vessel under the breast could open up a few hours after the surgery. It could continue to ooze. The breast would swell more and become painful. We would have to go back to the operating room to stop the bleeding. So again, not dangerous, not life-threatening, but something that would need to be taken care of. And that, my experience there is about 1 in every 200 to 300 patients that can happen. Next risk is firmness of the breast, and I'm going to use a breast implant to illustrate. This is a saline breast implant. When any implant goes in, the body makes a covering around it, which we call a capsule. If the capsule stays thin, the implant will feel soft under the breast. If the patient's body makes a thick capsule, it can contract around the implant, squeeze it, then the implant's going to feel firm. It's called capsular contracture. Happens in 5 to 7% of patients. Strangely enough, we don't know what causes it because it usually only happens on one side. And there's not much we can do about it except that there are some medications now that I am using that seem to have cut the incidence of this problem at least in half. The next risk is rippling of the implant. The capsule can pull in a way and cause the implant to ripple. You might be able to feel it, and sometimes you can see it, and again, there's nothing we can do about it. That usually happens in patients who have very thin breast tissue after pregnancy, not just small breasts, but thin breast tissue, and it happens more frequently in patients who have stretch marks. The last risk with a saline implant is deflation of the implant, leakage. If there was a defect, very slowly the saline would leak out, the breast would go down. It happens over a couple of months usually. The implant companies guarantee them, and I do the surgery for no charge. With this particular implant, I've only had 3 leakages, and I've used about 1,800 of them. So that's a pretty rare problem. Now, with a silicone gel implant, which I much prefer, not just because it's more expensive, but the silicone gel is much softer and pliable, feels more natural. If you get a capsular contracture, the implant still seems to be much softer. If it ripples, the implant is so soft the ripples tend to collapse, so you don't usually see them. And if this were to break, nothing would happen. This is what's called a cohesive gel. It sticks together. Some people refer to it as a gummy bear, but it's cohesive. It sticks together. So if you make a cut and squeeze it, the gel will come down like that, and if I let go, it'll pop right back in. It does not flow. So if the implant were to break, the gel can't go anywhere. The gel is certainly harmless in any event. But more importantly, these implants are tested to 1,500 pounds of pressure, and they won't break. So I know of no incidents in which one of these has ruptured in a patient.